Welcome to Headline Buster, brought to you by The Point with me, Liu Xin. In this series, as usual, I'll dissect stories that are making headlines around the world and talk to my guests to compensate for the missing pieces of the puzzle. So, join us in real time by sending us your comments or questions via the CGTN page on Twitter, Facebook, YouTube, or the Chinese social media platform Weibo. If you're watching this live on the CGTN application, you can email us at thepointwithalex@cgtn.com. Let me know what you think. We'll start our live streaming every Friday at 11 a.m. Beijing time, so do get in touch and we just might read out your comments. And the topic this week: the role of the World Health Organization in the global fight against COVID-19. Now, as the number of cases and death row keep rising in countries around the world, anger, fear, and finger-pointing have also proliferated. As of April the 10th, over 1.5 million confirmed cases have been reported globally, and the number of deaths has reached over 90,000. That's according to the Johns Hopkins Coronavirus Resource Center. Different governments have been put under a test, some performing better, others not so well. Yet, instead of looking inward and reaching out, some have chosen to point fingers, not just at China, but this time at the World Health Organization. U.S. President Donald Trump tweeted, "The WHO really blew it. For some reason, funded largely by the United States, yet very much China-centric, we will be giving that a good look." What's the reality? Here are a few key dates to recall. On January the 1st, the WHO set up the Incident Management Support Team, putting the organization on an emergency footing for dealing with the coronavirus outbreak. On January the 4th, the WHO reported on social media that there was a cluster of pneumonia cases in Wuhan. On January the 5th, the WHO published the first disease outbreak news on the new virus, a flagship technical publication to the scientific and public health community as well as global media. On January the 10th, the WHO issued a comprehensive package of technical guidance online with advice on how to detect, test, and manage potential cases. On January the 11th, China shared the genetic sequence of COVID-19 with the WTO. On January the 14th, a WTO official noted in a press briefing there had been limited human-to-human transmission of the coronavirus and that there was a risk of a possible wider outbreak. On January the 20th to the 21st, WHO experts from regional offices visited the city of Wuhan. On January the 22nd and 23rd, the WHO Director General convened an emergency meeting. The independent members from around the world could not reach a consensus on whether to declare an international health emergency. On January the 30th, the WHO declared COVID-19 a public health emergency of international concern, and the list goes on. The WHO has been sounding the alarm the whole way, like a thunderstorm, I would say, but the world decided not to listen. Take a look at this.
This is the time to attack the virus while it is actually manageable, small number of cases in the rest of the world.
We are so prepared like we never have been prepared. But we have done an incredible job. We're going to continue. It's going to disappear. One day it's like a miracle. It will disappear.
Meanwhile, infection cases started to spread and death toll started to rise. It was also vital to remember that this is a new virus. New information and data have been evolving every day. So hindsight is always 20/20, as they say, but the WHO was doing the best it could with the information it had at the time. Today, I'll look at one example of how the media can become an accomplice in a politically motivated character assassination of the world's only and most important international public health agency. The Wall Street Journal published an opinion piece by the editorial board on April the 5th, World Health Coronavirus Disinformation. WHO's bows to Beijing have harmed the global response to the pandemic. Now, the word disinformation is a very strong accusation, almost suggesting the WHO corroborates with China to mislead and harm the world. As an opinion piece, it might be dismissed for its stupidity, but as it was written by the editorial board, maybe we should waste a few more minutes on it. Now, the piece begins by trying to paint China as a villain, making it convenient to criticize the WHO for canoodling with China. It selected this piece of information in the beginning, that on the December 30th, Dr. Li Wenliang warned Chinese doctors about the virus, and several days later, local authorities accused him of lies that severely disturbed the social order. This could pass for being ill-informed, but excuse me, 3 days earlier, on December the 27th, other Chinese doctors had already alerted local health authorities of pneumonia cases. By the 1st of January, a special team had been formed by China's National Health Commission to look into the matter. The editorial also says Taiwanese officials warned the WHO on December the 31st that they had seen evidence that the virus could be transmitted human to human, but the agency, bowing to Beijing, doesn't have a normal relationship with Taiwan. By the way, didn't need the Taiwan region to inform the WHO, to warn the WHO of the contagiousness. Doctors were doing that anyway. The WHO, by the way, is a sovereign state member-only organization, and that's why Taiwan can't be a member, not because the WHO bows to Beijing. And this was clearly not a problem in terms of communication for the region. Otherwise, how could it warn the WHO about anything? The region has done fairly okay so far, clearly not hindered by its status within the organization. The editorial piece, echoing some attacks on social media, blames Dr. Tedros for the failings of the organization, saying he's a politician rather than a medical doctor, and that the agency has been corrupted by China's political influence. Evidence? He praised China. Wow, that's how you become political. In March, Dr. Tedros praised President Trump at least twice. Maybe he shouldn't have done that either, because that's political. Now, much hindsight has been cast on the competence of this organization. Honestly, the U.S. is the last country in the world to talk about what could have been done, what should have been done, for obvious reasons. The article says, however, it should have been an easy decision for the WHO Emergency Committee to declare COVID-19 an international public health emergency while meeting on the matter for the first time. It says the WHO head finally made the declaration on January the 30th, losing a week of precious time. Precious time? Maybe to others, but not to the United States, because it did nothing until mid-March. The WHO has to weigh the pros and cons at every step. Too much hurts the global economy. Too little hurts human lives. It's easy to look back and say it could have been done better, but again, not by anybody from the U.S., either the administration, nor the Congress, nor members of the press. The editorial board concludes by suggesting there is one way to ensure future pandemics are less deadly: reform or defund the World Health Organization. Talking about defunding the world's public health organization in the middle of a global pandemic, is that really wise? Or to reform, how? To give the organization more power, less power? The editorial board doesn't really have a plan, and clearly this is a very bad idea at the wrong time. Maybe an investigation should really be launched about how the U.S. has missed all the time they had in their hands. To label the WHO's efforts disinformation is not only scary, but a disservice to the international community when reliable information is direly needed. And you know what? Critics aren't only targeting the WHO, but also making personal attacks on Dr. Tedros. Let's take a listen.
Why would I care about being attacked when people are dying? Because it's personally targeted to me. 3 months in the same situation. But still, they can continue. I don't care.
Unfortunately, attacking international organizations or individuals who are doing their best under overwhelming circumstances doesn't undo the damage governments has inflicted on themselves during this crisis. But I don't want to go into that. There is plenty of coverage out there already. My second example, Al Jazeera on April the 9th published the piece, COVID-19, WHO boss calls for honest leadership from US and China. This is a rather neutral piece, I must say. Tedros urges US and China to unite in fight against coronavirus pandemic after Trump threatened to review US funding. The mic is taken away from Trump in this unfolding drama and given to the UN agency to hear what it has to say. And the message is important. The article highlighted Dr. Tedros' message when he said, please, unity at national level, not using COVID-19 for political points. Second, honest solidarity at the global level and honest leadership from the US and China. It also includes significant details that other articles left out, like when President Trump said his country was going to put a hold on money spent to the WHO. It says it was not immediately clear how President Trump could block funding for the agency under US law. Congress, not the president, decides how federal funds are spent, and that the United States is the top donor to the Geneva-based body. US contributions to WHO in 2019 exceeded $200 million, almost double the second largest member state contribution. China, in contrast, contributed $44 million. The article gives the podium to Dr. Bruce Aylward, a senior advisor to the head of the WHO, who said the WHO's work with Beijing was important to understand the outbreak, which was detected in Wuhan in December, and that this critical work is what the agency did with every other hard-hit country like Spain and had nothing to do with China specifically. We've said from the beginning, don't politicize a pandemic. It wastes energy, squanders time, and jeopardizes lives. But if media are complicit in tarnishing the reputation of the world's most important agency for public health, we've got a very dark road ahead. We'll talk about this subject after a short break, and when we come back, I'll have guests to get their thoughts on the controversy and also media's role in covering the story and why media rallying behind such scapegoating helps nobody. My guests will come from Pakistan, the US, and China. Do stay with us right here.